Blood pressure is the pressure that's on the blood vessel as the heart pumps and when the heart relaxes.
The circulatory system that the heart is connected to is a system of pipes. It's really not terribly different than the piping that exists in your house. But the pressure that exists in the pipes is what really is reflected then on the organs of your body: kidneys, heart, lungs, brain, etc. And there are ranges that are okay and healthy for these organs, and then there are ranges where there are problems where the pressure is too high, which can cause organ damage.
Generally speaking, 120/80 is a number that's floated around the most. You can go up to 140/90. 140/90 is the top normal of your blood pressure. There is no bottom normal when it comes to blood pressure. Now, once you breach the 140/90, you're considered to be hypertensive or you have elevated blood pressure.
What are the effects on the body of high blood pressure? Well, because you have this high pressure, your blood vessels are getting destroyed and damaged. But besides that, your heart as a pump itself is getting damaged, and that leads to congestive heart failure and other organ damage.
The problem is that most times blood pressure doesn't cause any symptoms, so people don't know it. It's really important that their blood pressure be checked and brought down to acceptable levels, because ultimately what's going to come from that is that we're protecting these organs that are exposed to that higher blood pressure.
What steps can one take to lower the blood pressure? Generally, a lot depends on your lifestyle. A good diet,
including fresh vegetables, fruits, grains, and staying away from the more processed foods which are high in salt, like potato chips and snack food, limiting the amount of alcohol intake, and staying away from canned goods and other high salt processed foods.
The next thing that we can all do individually is exercise on a regular basis. So good cardiovascular exercise will help bring down blood pressure.
If you can do 5 to 7 days a week, 30 to 45 minutes of cardio, toning exercise, whatever it may be, that will help to reduce your blood pressure.
Staying close to your ideal body weight, keeping a regular cardiovascular exercise program, and keeping salt at an acceptable level are the initial steps that everybody has to take.
Now, there is also a role for alternative approaches to blood pressure reduction, and I have been suggesting my patients to look into yoga, breathing exercise, meditations, Pilates. All of them have some role in reduction of blood pressure.
Other steps that sometimes are necessary for controlling blood pressure is medications, but people should always start with lifestyle modification.
Take the pledge.
Take the pledge.
Take the MedStar Health Million Hearts Pledge.